12 years ago, just searching for something better.
In July 2003, the executives of NuVasive took 3 of us surgeons down to Sao Paulo to see what Dr. Pimenta was doing, and it was very clear to me, bingo, this is the way to do it.
For many years, I was considered a crazy surgeon, and NuVasive, a crazy company that had a totally crazy idea and approach. It's more than proven after thousands of cases that is a very safe and very successful technique. So successful that almost all other companies copied the idea.
And in partnering with Dr. Pimenta, we were able to bring in technology, specifically neurophysiology, that ultimately became part of this assembly of technology into a procedure that created a more predictable clinical experience for surgeons.
I've been using XLIF for almost 10 years now, and it is the single most important technique that has changed my practice in all that time. It's improved efficiency in my operating room, also improved safety for the patients.
What started off as a simple procedure for a minimally invasive approach for degenerative disc disease grew rapidly in its evolution and application across a wide range of indications.
XLIF in many ways has revolutionized my practice. Our length of stay with our less invasive procedures has gone from 4 to 5 days down to 1 to 1.4 days. Our blood transfusion rate is almost 0, our infection rate is almost 0.
NuVasive provides a solution that allows a surgeon to reproducibly and safely do neuromonitoring during the operations. A lot of the other companies and vendors don't provide a solution that's as elegant or as integrated to the system.
Now my toolbox is much, much bigger. So now I can add in XLIF to do adjacent level disease all the way up to the diaphragm and above, instead of having to do a combination of multiple surgeries front and back. I can do this minimally invasive, so it's completely changed how I treat patients.
How many patients spent fewer days in the hospital because of XLIF? How many patients spent fewer days in rehab because of XLIF? How many patients took less pain medications because of XLIF? How many patients didn't have to have a blood transfusion or have some major complication because of XLIF?
First 15 years of XLIF was about accumulating this data, showing that this is the most powerful way to operate on the front of the spine. But now we move to the next level.
I think the big problem that needed solving when it comes to XLIF is how are we going to treat L5-S1? And now, via lateral ALIF and our entire lateral solution platform, you truly have that opportunity to take control of the spine and very precisely, scientifically, put it in the proper alignment, all through a minimally invasive approach. That's been missing in the marketplace, and I think the combination of IGA, XLIF, the entire lateral solution platform does exactly that.
The ability to do the entire surgery in a single position has saved hours, even for a single operation. The time it takes to reposition a patient, potential contamination of all the implants and the trays, and bringing another table in, it just takes so much time, has the potential to increase infection rates, but it's all obviated now by the ability to do this all in a single position.
For example, at L4-5, you can routinely do an XLIF bilateral posterior fixation in an hour. And that just revolutionizes your practice in terms of the amount of efficiency you can achieve. Lumbar fusions that used to take 3 or 4 hours in an hour, it's unmatched. We've done this for several months now as part of the design process. And still, after every case, I look at Brian, my rep, and I'm just amazed. Did we just do that? I mean, it changes everything. We're getting to a very exciting point where now we have these other solutions, and I'm super excited about this part of the trajectory of where this is going.
Now, one of the best products that recently got released is something called LessRay.
Anything we can do to help decrease radiation or radiation exposure to the staff in the room, in addition to the patient, I think should be at the top of our priority to try to do that. So it increases your efficiency, decreases your OR time, decreases the radiation to everyone in the room and to the patient, and it's just a win-win for everyone.
I mean, I think there's some literature that said that the average minimally invasive surgeon gets his lifetime worth of radiation exposure in about 10 years of his career. We had 70–80% reduction in the amount of radiation that we used. That's meaningful to me. I mean, that's a personal issue in terms of my safety. So it's amazing technology.
that philosophy of innovation and doing things differently just permeates throughout the entire organization. They listen and they try to think about things in a different way.
And they really care about getting a bunch of surgeons together in a room, listening to us, and taking it from there and innovating based on what we think might work.
NuVasive has never been about imitation. NuVasive has always been about pioneering.
The technology that we're utilizing at this point is really just scratching the surface. So the amount of runway that we have in front of us is absolutely phenomenal, and it's really exciting to be a part of.
Modulus is a new interbody technology that NuVasive has for their lateral interbody implants.
So this is a large model of the Modulus XLIF implant. We have our body lattice, which has been optimized to remove as much material as possible and really enhance imaging and increase biologics penetration and physiologically relevant loading.
It's a 3D printed technology, so there's a lot more capacity at a reasonable cost point to create modularity for different patients, different sizes, different shapes, different angles.
The Modulus implant was designed to be fully porous. It allows for complete biologic integration.
The fact that it has a titanium lattice structure with some porosity means bone will more readily want to attach or grow into the surface structure fairly early in the process, where before we'd have to wait often 3 to 6 months to get what we perceive to be a reasonably solid fusion.
Outside of titanium, looking at the PEEK portion of the market, there's tons of opportunity to integrate porous PEEK technology to get similar benefits. The end goal is still the same, to drive clinical benefits within that space.
We are doubling down, we continue to acquire companies, we're ramping up our R&D, and we're putting more money in to making the surgery of spine just that much safer, that much more predictable, and in the end, that much more efficient. We marry up our great innovators with the great surgeons who have the insights and the touches to come out with groundbreaking technologies each and every year.
NuVasive has always been on the leading edge of innovation. They don't sit back and say, we just developed the next greatest thing, now we can stop. I mean, they're always looking forward to try and make either that product better or develop a new product that will, again, go back to improve our patients' lives.
The reality is we're just getting started. The innovation will continue, and the commitment to patient care and better outcomes will continue as well.
Every time I talk to the people at NuVasive, they tell me we're working on the next version of Maxis. Wow, and that's fascinating to me, because Maxis is already so good in my mind, but they continue to think, how can we make this better? How can we make lateral access surgery better?
Why XLIF? Why NuVasive? Because it is unique, it is proven, and it continues to be challenged by us, no one else, to make it just that much better.